Welcome to Voices in Nursing with Dr. Nozil, Care, Policy, and Leadership. I am your host, Dr. Yolaine Nozil. Today's conversation centered advocacy and action, nurse leading legislation change. Nurses are not only caregivers at the bedside, they are powerful voices shaping laws that impact health equity, access, and patient outcome. Join us as we explore how nurses are transformed lived experience into legislative influence. With that being said, I am honored and to have the privilege to welcome Dr. Michelle Nelson. Thank you, Dr. Nelson. Thank you. Welcome.
So thrilled to be here.
Oh, thank you. Thank you. Thank you. So, Dr. Nelson, I know the abbreviation was so long, and then the scholarly work that you've done is so long. I am going to ask you to introduce yourself to the people who are listening to you right now.
Okay. Well, first and foremost, Dr. Nozil, I am so thrilled to be with you today.
Thank
That's
you.
number one.
Thank
I
you.
want to thank you for the opportunity to be here and to share my advocacy journey,
Thank
to
you.
share my work, and to hopefully, if I've done my job correctly, anyone listening out there this
Mhm.
evening is going to be inspired to get up and to get out and to serve as an advocate. It's
Yes.
probably one of the most fulfilling, life changing things that you can do because we are all responsible as citizens, as global citizens,
Yes.
to weigh in and to be a part of change if we think that change is needed. Mhm.
I agree. I agree.
Mhm.
So tell me about Dr. Nelson. How do
Oh,
you get to legislations and then policy? Tell us.
I tell you the honest truth. Sometimes I will go somewhere and someone will read my bio and I'll say to myself, who is that chick? I want to meet her. She sounds incredible and she is me. I guess it's because so much of my life has been dedicated to doing the work. You
Mhm.
know, when you're grinding and you're working, you're not really cognizant of all the hard work you're doing. You just keep go, 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 go. You just keep going, particularly if you are passionate about the work that you're doing.
Yes.
When you're passionate about something,
Mm-hmm.
don't tell my boss this. I would do it for free. And
Mm-hmm.
so, the body of work, the depth and breadth of the work expands exponentially. You don't understand when it's happening, but when you're seeing the fruits of your labor
Yes.
and the impact of your work, that's when it really kicks in. I'm a girl from Brooklyn, New York. I was born and raised in Brooklyn, got married to a phenomenal gentleman. We are going to be 25 years this year.
Yay.
We went to high school together.
Uh,
We got married. And as soon as we got married, I was like, buddy, come on, you said that you were going to be doing this and I want to take over the world. And now you tell me that you don't want to. Like, we're not going to make it.
mm-hmm. Mm-hmm.
So I said, you got to get another job. And like in a month, he came home and said, guess what? I got this great job. And I said, great. When do you start? He said, 1 month. And we're moving to Atlanta.
Mm.
Moving to Atlanta? What are you talking about? I said, go get a job. I meant in the state where we live. I didn't think that I had to tell you, get the job in New York. And he moved out here and I stayed in New York.
Okay.
And we were newlyweds, and it was a very difficult transition. And one day, my mom called me and said, "Girl, you were crazy.
Mhm.
I heard about the girls in Atlanta. You better get down there before you don't have a man." I was
Oh,
like,
that is true.
"What?"
I heard that too.
Exactly. So I jumped up and I um, went to my boss and said, "I'm leaving." And And she was like, "What are you talking about?" I said, "I am leaving. I have to go. My mother called me and told me this craziness, and I'm out of here." So I was working as a family nurse practitioner at that time.
Mhm.
I had gone to school in New York and had joined a practice. I had only been there a year, and it was so wonderful and supportive. My first NP job, I was really striving and thriving,
Yeah.
and I was sad to have to leave the job. And
Right.
so I moved to Georgia and kept flying back
Back
and
and
forth
forth.
every week to go to work. It was crazy.
Mhm. Mhm.
And then it just became too taxing for me. So I sat in my office and I Googled PhD programs in Georgia. I knew. And since I was a little girl, I was wanting to be a doctor. I started out wanting to be a physician at first, and
Okay.
then realized that nursing was for me. The way that I can impact people in the greatest ways with the greatest outcomes. It fit my personality to be able to be at the bedside and take care of families and communities and nurse people back to health from the womb to the tomb.
Yes.
We do it
Yes.
all, everything in
Mhm.
between. And so I came down here and it was just getting too difficult. So I sat and Googled PhD programs, and up came Emory, and they were saying that they had a free program and
Oh.
they pay you to come.
What?
I said, "What kind of sorcery is this? Let me call them up and tell them that this is a typo on their website." And I got the administrator, and
Mhm.
she explained to me that, um, yes, we pay you to come,
Wow.
but it's very competitive. We only take 5 people a year, and we've already got our cohort for the year. I said, "I don't care what kind of cohort you have. This is advocacy lesson number one.
One.
Okay?
Mhm.
Advocacy lesson number one for you guys. I don't care what kind of cohort you have. You don't have a cohort if I'm not in it.
Yeah.
What kind of
That's
cohort
right.
you talking about?"
Uh-uh.
I had to come to the thing. She says, "Well, we have all the people. The application time frame is closed.
Open it.
We need all these. What did you say? Hold on.
Open it.
Open it. Hold on. We need these GRE scores. We need this. We need that." And I wrestled with her. I wrestled with her. It was a Friday evening, and the lady got so disgusted. She said, "You know what? I really have to go. If you could get me a completed application in 1 week,
Mhm.
I promise you, I'll put it forward and we'll take a look at it." What did she have on her desk in 1 week?
The
That
application.
completed
The
application.
application.
So, lesson one, no is for everyone else.
Mhm.
No
Yeah.
is not for me.
Consistency.
In my life, no is spelled YES. I
Mhm.
only know yes. No and rules are for everyone else. Because if I want something bad enough, I cannot be kept from it.
Go get it.
I cannot be turned around. I cannot be led astray. I am going to fight to the
Teeth.
ends of the earth
Mhm.
to get what I want.
Yeah.
And so I got into the program. It was extremely challenging. I didn't know what I was getting into, but that cohort of very smart, extra smart, exceptional people
Mhm.
that they told me, well, maybe, maybe you are not fit or cut out for this.
Mhm.
I graduated one of two people out of that cohort. Two people. I was one of them, which really taught me in life that even if you don't know, you can learn.
Mhm.
Even if they tell you no, make it a yes.
Mhm.
Even if it looks too challenging, so what? Challenges are there for you to be inspired and motivated and to rise to the occasion and get what you want.
Yeah.
I finished the program. I was recruited to go to Georgia State University, and there was an instructor there
Mhm.
that worked for me in my lab. And he said, "Look, I'm the president of United Advanced Practice Registered Nurses of Georgia, and we lost our secretary. So we're looking for someone." "Okay, I'll help you find someone." He said, "No, Dr. Nelson, you." I said, "Me?
That's
I
it.
would be the worst secretary ever. I'm going to turn on my reggae music and all the papers are going to fly out the car. You're never going to get your minutes. You're never going to get anything from
Mhm.
me." He said, "But we don't need you for that. We need your energy."
Yes,
That's what
yes.
we need, Dr. Nelson.
Positive one.
Bring the
Hmm.
energy to us. We're going to figure out the rest. Started with the board, a mess, a mess. I used to haul up to the meetings with popcorn and wine and
Hmm.
just watch them go crazy. And I said to
Wow.
myself, if I was the president or I was in a higher leadership position, this is what I would do because it's obvious that they need help.
Hmm.
And
Hmm.
then the
Yes.
president had to step down and I took over the position, had never led anything. But this is advocacy in action. This is number
Yes.
two,
Yes.
right? Number two.
Hmm.
I did not know how to lead, but I was smart and said, who are the leaders of all the other organizations in existence in Georgia? What are the top nursing organizations and who leads them?
Yes.
I called them individually and invited one for coffee, one for tea, one for brunch, one for lunch, one for dinner.
One
And I
by
said,
one.
one by one. I said to them, you know what? I heard about you. I heard you're the top leader in Georgia. And so I wanna be mentored by you.
Oh.
I didn't know these people from cats from Adam's cat, but people love to be praised.
Hmm.
People love to hear that they're worth something.
Acknowledge,
And,
yeah.
and most importantly, at that time, nursing organizations were working in silos. Everybody was in their own little corner doing something new.
Yes.
So I didn't know much, but I knew that they needed someone to bring them all together, tie them all together, because there's power in numbers. So if we have great organizations in the state and the organizations are all doing something different, or maybe they're doing the same thing, but
Hmm.
they don't even know that you're doing it. That means you're wasting resources, you're wasting
Time.
energy, you're wasting talent. So let's all come together.
Hmm.
And so by default, I became the unifying, the like a the hub in a hub and spoke model. I was
Hmm.
the hub, and everybody else was
Surrounding that, you
was
connect them together, just like a chain. You in the middle of the chain where they connect.
the person who knew nothing, but I knew enough to bring everybody
Them together.
together. And then the greatest attributes that each of those leaders had, I took, you borrow from this one, that one, the next one, and then you put together your own leadership style.
Hmm.
And that's how my leadership and advocacy was born in the state of Georgia.
And you know what? You have the collaboration skills that can bring all those people together.
But you know what's also very important that people don't understand? And I'm going to share with you guys, this is a conversation that we had
Hmm.
before we started. Dr. Nelson, how do I get started? How do I get to this level? How do I get to We all start somewhere. I
Yes.
started nowhere. I didn't know anything, but something that I share with my students. I didn't even get to introduce myself properly. I
Hmm.
am the
No, it's a
I
conversation.
didn't even get there yet. I didn't even get the introduction. So I am currently the director of graduate programs at the mighty, mighty Clayton State University.
Yeah.
And I am also the Region 11 director for AANP. So I cover Georgia, Alabama, Mississippi, Florida, and the U.S. Virgin Islands.
Okay.
I'm also a commissioner for the state of Georgia on the Georgia Commission on Women.
Okay.
I sit on multiple boards, more boards that I can shake a stick at, and committees. But see, none of that matters. You were talking about all the letters behind my name.
Yeah.
My family makes fun of me. They call me Michelle with the 35 letters. And I always wondered what they meant by that. And I counted 35 letters behind my
Abbreviations behind your name.
because that doesn't matter.
Hmm.
That just is the outcome of the body of work. What matters and what I want people to know about me is that I am a relentless advocate for access to health care in the state of Georgia.
Yeah, I can say it with
Yes,
the
yes.
yes. Me
And
too.
anyone who comes along, whether you're starting from scratch like I did, you're a novice, you don't even know how to spell advocacy, or you're a seasoned advocate.
Hmm.
I want to work with everybody because someone took the time to train me. Like I said, I
Yes.
went and I sat with all these people. I buttered them up and bought them dinner, of course,
Hmm.
but the passion and the zeal and the zest and the
Desire.
vim and the vigor
Yes.
for wanting to do the work was evident. And so, how could they deny me? Because remember, I don't understand the word what?
Advocacy.
I don't understand the word
No,
no.
no.
So they couldn't say
No to
no
you.
to me. They're going to train, they're going to work with, I'm going to show up, whether they want me, they don't want me, I'm showing up anyway.
Yeah.
And so, the next lesson in advocacy, you got to show up, you got to stand up when you
Hmm.
show up,
You
and then you got to speak up.
yes. Show
Show
up,
up,
stand
stand
up,
up,
speak
speak
up.
up.
That's right.
Okay?
Guys,
So
show up, stand up, speak up. That's advocacy.
show up to whatever is going on. You don't
Yes.
care what it
But it
is.
is. Yes.
It could be a shoelace tying convention, and advanced practice nurses are going to be there. You show up,
Mm-hmm.
shoelaces in hand, and
Show
you
up.
just say,
That is right.
so I'm
And
sure that you did this a
yes,
lot in your journey as
yes,
well. You
yes.
showed up.
I've been everywhere. And people call me social butterfly. And then they say, don't you tired? You all over the place, you doing all this. I am a member of 11 organization.
11. That's
Yes.
lazy. 11. It should at
It's
least be
like
a 110. Put a zero behind it.
11 organization. And I'm paying membership fees, and I went to whatever they're doing, whatever they're doing, I'm there.
But Dr. Nuzil, you know why?
Networking too. So,
11 organizations. But I'm going to pick up on something that you said,
mhm.
that you show up.
Yes,
Because, first of all, you're paying your dues.
yes.
And remember, leaders like me, when I was the state president of UAPRN, although I'm a leader, I'm there to serve you. See, a lot of leaders forget that.
Mhm.
You may be in a leadership position, but your job is service
Service.
to the people who are paying the dues and who are expecting change from you.
Yes,
You have to perform. These people are paying their hard earned dollars to you, so you need to provide to them what they have come to you
yes,
to get. So you're doing the right thing. You belong to 11 organizations. You show up and you let them know what your interests are. You
mhm.
tell them, I'd like to see a change in practice regarding this, regarding that. Advanced practice nurses, bedside nurses.
Mm.
I want to see this legislation put forward. I would like to see a new committee form.
Yes.
Get on the committees.
Hmm.
Get on the committees and
Yeah,
have a
oncology.
voice.
I've become a member of oncology.
Well,
So
ONS, oncology
yes,
nurses,
on yes. Hmm.
absolutely. Get on there and understand and lift your voice,
But yeah.
because your voice is your power.
And that is why I started this podcast also.
Okay,
And I started this podcast just to learn from all the expert like you that's come in and talk about advocacy, leadership, and policy, and also teaching patients and family, let the educate them about what's going on, how they
absolutely.
can how they can help and serve, and especially with patients and family members
Right.
when they go vote, who to vote for, what it is, what.
Hold on a second. We're going to stick a pin in that. We're going to
Okay.
come back to that. Make sure that I come back to
Yes.
voting. Go
Uh-huh.
ahead.
And then so they will learn and know. And then what I usually tell them, we said, let's learn, let's lead, and let's change healthcare together.
Okay. So hold on a sec. Hold on a second. We have show up,
Hmm.
stand
Say,
up, and speak
speak.
up, and let's
Let's
learn,
let's
let's lead,
lead.
and let's change. You heard it there. You got
Yes. 3 and 3.
two slogans right
Uh-huh.
here that really encapsulate the level of work and why it is so very important. This is your advocacy.
Yes.
This is your advocacy. And when I speak to people, I tell them my work is also my ministry. This is my ministry.
Mm-hmm.
right?
Right.
And when I came in and you took me around and gave me a tour, and I walked into the space, like I could feel the energy that this
Thank
is
you.
also your ministry, that you're dedicated and you're committed to providing a space for people to come in and and motivate and
Yes.
encourage people and to meet them where they are,
Hmm.
so they know that they don't have to be Dr. Nozil.
Yes.
They don't have to be Dr. Nelson. You don't have to be Dr. Anything. You just need to be the person who wants better for yourself, for your family, your community, Georgians, our nation, and as global citizens. That's how we should be looking at ourselves. As
Yes.
global citizens, we want healthcare to be recognized as a top industry, and that nurses, the largest workforce globally,
Hmm.
that we are the ones that are on the cusp of changing healthcare.
And I know we can do better.
Oh,
We
we
can
are
do better.
we can do it.
Hmm.
We are doing it, and we got to do more.
Yes. Yes.
We got to do more.
No, we're not. It's not. And then what I want to say, we are a profession.
So, you opened up a can of worms. You went there.
Oh boy.
You went
Well,
there.
I have some specific questions
Oh,
for you. 'Cause,
we got off to a bang. We haven't even answered a question.
oh
Yes, please.
yes, yes, yes. And then thank you for. I'm so excited. I don't even know where to start with the
Well,
questions.
we're vibing. We're having a conversation. So
Yes. So, how do you find nursing advocacy at the legislative level, and why is it critical now? Uh,
people have to understand, and this is a concept or concepts that people don't get. Legislation, policy, and laws undergird every single thing you do: the food you eat, the air you breathe, the water you drink, where your kids go to school. Can they
mhm.
go to school? Can you go to school? Is
Yes.
there money to under see? I'm winding
Yeah.
my way back to the professional conversation, but I'm not going to touch that. That's a
Yes.
discussion for another night.
Yes.
But legislation undergirds your ability to get money to be able to go to nursing school. There is no part of your life that
Hmm.
is not touched by policy.
Yes.
Okay. And so when it comes to healthcare policy, nurses are, we're the number one advocates. We advocate at the bedside, we
For
advocate for ourselves.
patients.
As you can see, the amazing nurses in New York right now, my sisters and
Hmm.
brothers in NYSNA are out there advocating for
For nurse.
themselves. We are amazing advocates. But when it comes to being on the front line and and fighting for
Yes.
the policies that drive and support our ability to practice, it's
Hmm.
like we go silent.
We can't go silent.
We are silent.
Hmm.
I'm going to tell you this. In the state of Georgia, if I'm being honest, this is going to sound so horrible, but it's the truth. There's probably about five core people, myself included,
Hmm.
that are on the front lines of policy for advanced practice nurses that are at the Capitol at
Wow.
this current time. And we have tens of thousands of advanced practice nurses. And when I'm talking about advanced practice nurses, nurse practitioners, clinical nurse specialists, nurse anesthetists, and nurse midwives, there are approximately 160,000 nurses in the state of
Of
Georgia.
Georgia.
We're the
Yeah.
largest voting block for healthcare professionals. If we were five people, like
That's
you
not.
guys
It's
are
not.
out
It's
there
not
allowing
acceptable.
five people to be out there
Mhm.
crafting. You don't know what I'm doing.
No.
You don't. I could be a nut,
Yeah.
but I'm the one that's at the Capitol fighting on behalf of advanced practice nurses because we don't have anybody else to come. If each of the 170,000 approximately nurses in the state of Georgia showed up, and if each of them gave $10,
Hmm.
$10 is a cup of coffee and a sweet treat.
Yes.
If I asked you, Dr. Nozil, for a cup of coffee and a sweet treat, would you give it to me?
Yes, I'll give it to you.
Absolutely.
Yes.
But we have organizations out here begging and pleading for people to give something to their organizations so that their political action committees, also known as a PAC,
Hmm.
has money in the coffers so that when we go to the Capitol, we have something to give to legislators.
Yeah,
Okay? We need everybody out there to join an organization. If you're in nursing out there listening, you should
they
be a
should.
member of Georgia Nurses Association,
Yes.
the organization that is the statewide organization for all nurses in the state. United Advanced Practice Registered Nurses of Georgia. This is the statewide nursing organization if you're an advanced practice nurse. And you have a lot of other specialty organizations, GAPNA, NAPNAP, all
Yeah.
kinds. Okay. Haitian American Nurses
Nurse Association.
Association,
Hmm.
Nigerian Nurses
The
Association. I'm
Filipinos
sure
Nursing Association.
Latino, if you, I'm sure I could have a Black Shoes Nurses Association.
Yes,
There's
yes.
all kinds. But if you guys are not showing up and you're not
what
giving your money and
what
you're
we gonna
not
do?
giving
And
your
we want
time,
change. We want change. How are we gonna want change if we don't do anything?
it's like winning the lottery. You got to be in it to win it. You
You have
cannot.
to play.
You got
Mm.
to play. So you cannot sit and complain about Georgia, which is the most restricted state of all in the
Hmm.
entire country for advanced practice here.
In the Georgia,
So,
yeah.
a lot of people complain that we don't have full practice authority. We don't have the ability to write prescriptions for Schedule 2 narcotics. We can't order home health. We can't, but are
And
you at the Capitol?
wood care nurse can give advice and telling the doctors what to do. A wood care nurse, you don't have to be
So you
certified.
can be the wound care
Mhm.
nurse and you can be the one to go to the
Uh,
homes to take care of these people. But and you're the person that they know,
mhm.
particularly in the rural areas. You're the person that they know as their provider, but you can't write the order for them to have it.
But you know what? If you live in the rural area, a lot of hospitals closing in the rural area because they cannot survive. If somebody's living in a rural area, how are they going to get help with the
Well,
wound care? With
I have the solution, right? Advanced practice nurses are one of the solutions for the rural area. You guys hear me out
yeah.
there? Advanced practice nurses are one of the best solutions to cure the ills of what we see in the rural area. This is a workforce of individuals who are ready to be able to go and open a practice, just as Dr. Nozil has her beautiful business here.
Hmm.
We are trained to be
To be,
entrepreneurs.
yes.
We can go open our own practice and start seeing patients.
Hmm.
Advanced practice nurses do not want to be doctors. If we wanted to go to medical school, we
We'll
would have.
go. Yeah, because they have
We
the years down. Hmm.
we are advanced practice nurses that practice under the nursing model. And we have the ability, particularly when it comes to primary care, to
Hmm.
be able to go out and treat individuals. Diabetes, hypertension, cardiac disease, renal disease, these things that are plaguing our communities, particularly if you're Black and brown.
Yes.
We have the ability to go into these areas and provide care, but its policies, antiquated, outdated, ridiculous policies are in place to keep us back.
Hmm.
And you know what? You're not hurting advanced practice nurses.
Yes.
We're making six-figure salaries. We have insurance. We open businesses. We do well. This is hurting who?
The public, the people,
Georgians.
Georgia. Yes.
This is hurting Georgians, and we gotta do better.
And then you know what, Dr. Nelson, I wanted to the people, if you are listening,
You better be listening.
this message, this podcast, share it with any nurse practitioner that you know, any nursing, any healthcare providers. Share this episode to them. I want them to be engaged, involved, so we can make changes. And then if you share it with somebody, and you're not helping the providers, you're helping you, you're helping yourself, you're helping your family, you're helping everybody's in Georgia, or it's a nationwide thing. Anywhere that they have healthcare issues, healthcare issues problem is our problem. It's everyone problem. Please share it, subscribe, and share it. Share, 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 share.
So, we were talking earlier when we came in about what we would discuss this evening. And one of the things was, how do you define advocacy?
Yes.
Advocacy is the intentional utilization of resources, of your voice, of you know, financial instruments,
Yes.
anything and everything that you have to be able to um, bring people to a higher level and access of healthcare. So that's the basic of advocacy.
Advocacy.
To be an advanced practice nurse who's an advocate is
Mm-hmm.
now taking it a step above, where you are now doing the same level of work, but you're empowering people to also be advocates and bring them along so
Yes.
that advanced practice nurses and other healthcare providers like PAs, it's not just us that are in the fight to
Mm-hmm.
be able to provide care.
Teachers. Mm-hmm.
Teachers, anybody and everybody who cares about healthcare, the general public, lay
Mm-hmm.
people, because there is no one who will not intersect with the healthcare space at some point. We're all going to
We
get sick
all.
and have to
Yes.
go see a doctor, a nurse, or something. Who hasn't seen a nurse? Nobody.
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 Yeah.
Okay. So it is very important that we understand how advocacy is defined and that we as advanced practice nurses are going to empower people to be able to go out there, which is what we're sitting here doing right now, doing our best to empower people to start
Yeah,
somewhere.
let them know that you can do something. You can help shape healthcare.
Exactly. So, I'm sure there's someone out there who's saying, well, Dr. Nelson, how do I get started? I'm scared. Dr. Nelson, I'm
Mm-mm.
shy.
Can't
I'm,
be
I'm shy.
scared.
I'm shy like
Yeah.
you, Dr. Nelson. I'm very
Mm-mm.
shy.
Me too. I'm shy, but
Right.
I've get into the microphone. I've show up.
Yeah.
Yeah, I show
Because you
up.
know what? It will be me interfacing with the healthcare environment. And I want to make sure that there is access to care for me,
Yes.
for the students that I pour my heart and my soul into, that they are ready and practice ready on day one to be able to go out and care for you and your communities. So, in order to do that, for me to do what I do, even in an academic space, there are also policies that undergird my ability to teach,
Mm-hmm.
right?
Yeah,
So,
right.
you may be asking yourself, how do I get started as an advocate? Start showing up. Start showing
Support.
up.
Support.
Yeah, you
Mm-hmm.
belong to your nursing organization. Most nursing organizations that are worth their salt are going to have, if not online, they will have face to face opportunities
Mm-hmm.
for the members to come and engage.
Yeah.
Go to the meetings, you're paying your dues. And if you're not paying dues to some organization, join. That's the first thing. You need to join because they need your voice, they need your resources, they need your
Mm-hmm.
help. Okay?
Like GNA have a lot of members, but
Yes.
when in meetings, you can count how many members in a room.
It's sad. They have a lot of
Yeah.
members, but when you look at the amount of nurses in the state of Georgia, a fraction belongs to GNA, and we need to do better.
Better. Yeah.
How are you expecting the healthcare landscape to get better,
Mm-hmm.
particularly for you, if you don't show?
Involve. You don't show up. You don't engage.
I'm not a bedside nurse. I'm an
Mm-hmm.
advanced practice nurse, and my bread and butter is academia. But
Mm-hmm.
I'm the one at the Capitol yelling, screaming, fighting, wheeling, dealing.
Yes.
The only way that I'm going to know what you need as a bedside nurse is if you show up and tell me.
Yes.
I
Mm-hmm.
need to hear from you. I'm not going to know how to advocate for you, what to advocate for. We're not even going to know how to write because write,
Mm-hmm.
we literally write that legislation. we're not going to know what to put in it and to not put in it, which might be harmful to our ability to practice unless we have dedicated people that are going to tell us. So you don't have to come to the capital. Maybe you live all the way in South Georgia. You can't get to the capital, but you can serve as someone who will do some research.
Yeah, like I
Okay.
spent most of my life at bedside. I love bedside.
It's
20,
the most
yeah,
rewarding.
yeah,
Yeah.
25 years doing critical care,
Yes.
rapid response.
Uh-huh.
When I went to get my doctoral, so I went because we don't do any, most of the people at bedside, they go work, get tired, and then go home.
But I'm gonna, let me confess something.
Hmm.
I was a critical care nurse for many years too, and young.
Yes.
So I worked hard. When I got off work, you know what I wanted to do? I want to party. I'm a party girl,
Uh-huh.
right? I became a nurse when I was like 20 years old. Oh, I was making great money and I want to party. I'm not engaged in healthcare policy and advocacy. I've been a nurse for nearly 33 years, and I'm
What?
a nurse
Good.
practitioner for 25 years.
Hmm.
And it wasn't
You're a nurse
until,
practitioner young too, at a young
yes,
age.
I did not get involved in advocacy, as you heard me say, until I got my PhD. So all of that time, I really wasn't engaged. I belonged to organizations. I went to their conferences
Hmm.
because I love to go speak at conferences. I was a motor mouth. I would like to present my research, but I wasn't really engaged in what was going on. Just show up to
But you
work, do your
changed
duty.
something. You changed something
Because
because I'm gonna tell you, you have your students. I was on the legislative meetings.
uh-huh.
We have about 10 or 12
We have
students.
17
17
of my
students
students
showed up
at
at
one
the
Plainview State.
legislations, the Ganali
Yes,
meetings.
yes.
So they're learning at a young age, and you didn't learn that.
So
You're teaching them what you didn't know.
what I did was I shout out to Georgia Nurses Association and their Janali program. I embedded it in my curriculum,
Wow, that's
right?
impressive.
I embedded it in my curriculum, so they don't have a choice. They have to go. Right? And
Right.
they have to write up what they're learning, what they're doing. They have to present to me. Shout out to Dr. Lisa Eichelberger. She's my co-instructor for the health policy class at the
Okay.
mighty, mighty Clayton State. Again, I I take it very seriously because it took me too long to get my footing in the advocacy world. The only reason why I really got so fired up, let me tell you when I had a quantum leap in my mind.
Okay.
My lobbyist, the amazing Juliana McConnell, she had started as the lobbyist for the Coalition of Advanced Practice Registered Nurses. I was one of the co-directors with Dr. Desiree Clement. Shout out to Dr. Clement from Emory.
Okay. I
Um,
know Dr. Clement.
yes,
Hmm.
and so she said, "Well, if you're the leader of this organization, well, you have to come to the Capitol. Like this is what we do."
Hmm.
So shy me, knees knocking together. I go down to the Capitol. I have my 2 minute elevator speech prepared,
Hmm.
and I go speak to my senator. I'll never forget
I was
Senator
there last year.
Senator John Albers. He's currently still my senator. He was very gracious, and he listened to he listened to maybe 1 minute of my 2 minute elevator speech, and he said, "Dr. Nelson, let me stop you right there, and let me tell you why you're never going to get what you want." It was like he had slapped me across my face. He said, "You know, legislators realize that they don't really have to listen to nurses because you guys are so fragmented. You're disjointed.
Oh.
You operate in silos. You fight each other.
Oh
You don't
gosh.
come with a consistent message. You know, each organization is coming with a different list
Different.
of that. Like you guys are not together." And
That
right,
hurts.
oh, but it hurts so good because
All
I
right.
went home because I'm a New Yorker. We love a good challenge and a good fight. And I said to myself, he's so right. He's right. This is when I started to really
Mm-hmm.
get into going to the other organizations and trying to pull them all together so that we were speaking with one voice. One voice. It's like being in a band. You
Yeah.
cannot have the drums louder than the this, or being in a choir. A choir is one voice, not one person singing really, really loud and everybody else is kind of trying to catch up. It's
Mm-hmm.
one blended voice, and that's what we needed. And I said to myself, there's got to be a way to elevate things for nurses in the state of Georgia. And so it was very important for me at that time that I reach out to everyone and say, look, you've got to come down to the
Rose
capital.
Capital.
And I also realized that being an advanced practice nurse from the state of New York, where I could pretty much do any darn thing to my
Mm-hmm.
patients,
Mm-hmm.
anything I felt like doing,
Yeah.
I
Yeah.
am no faster, stronger, smarter than the advanced practice nurses
And
here in
resources
Georgia.
right here, they don't use it.
We all have the same national level certification and organizations.
Mm-hmm.
Like, they needed help. And
Yeah.
so
Yeah.
I brought my big mouth from New York and went to the Capitol and started making noise.
But one things I wanted to ask you, we like I tell people, and then when I'm doing the show, they keep saying that we have a shortage. I say we don't have a shortage of nurses. We don't have a shortage of provider. We have a crisis of provider because the resources are there. They don't use it. And then now the hospital. Do you know an emergency room right now in Georgia? We have people staying 3 days, 3 days in emergency room waiting for care.
But why
If
is that? But why is that?
because they don't the resources, they don't use the resources. Well, the restriction that the API and the nurse practitioners have, if those API and or nurse practitioner have the clinic to see those patients, they would not be needed to go to the emergency room.
Ding, 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 ding. And the light bulb goes off. Absolutely. We would be able to avert this crisis where you have such a skewed payer mix
Hmm.
at these hospitals, where you have so many people who are coming into the hospitals who don't have insurance,
Yeah.
and so the emergency room is used for primary care, where these individuals should be seen in the rural areas where they live. We also need to understand that here in the state of Georgia and federally, there's enough of us to lift our voices to understand that we needed to have expanded Medicaid.
Yeah.
There
Yeah.
needs to be more resources from Medicaid and Medicare so that we can meet the needs of Georgians. Like, people are still going to access the healthcare system. They're not going to sit home and die.
Yeah.
However, if we could get to them when the crisis is much smaller,
Hmm.
then they show up to an emergency room because they've had no care, they have no insurance. They're showing up to the emergency room in absolute crisis.
Yes. Yes.
And so, what are we doing as a state? We have billions of dollars in surplus. Billions of dollars. We hear our leadership down under the gold dome tell all of the billions of dollars in surplus. Why is it not going back to the people and going into healthcare? But
But
if we, the people, raise
don't
our
say
voice and
anything. Don't
we
raise.
demanded,
Yes.
we demanded. I told you earlier to stick a pin in voting. You talked about voting.
Uh huh. Yeah.
I remember I was teaching when I was at Georgia State University. I was teaching the advanced practice roles course, and I was there. Oh boy, this day I was in front of the class. I was sweating. Boy, my clothes were wet. It's like I was preaching to them. I was in the zone.
like,
If
like
you
a
think I'm
Sunday
animated
Sunday
right now,
church.
honey, the only thing I needed was the pulpit and past the collection plate. And tamarines. I had gone crazy. And this one student, he put his hand up and he said to me, "You know what, Dr. Nelson? I've never heard anything like this. I'm so inspired
Hmm.
today. You've changed me.
Yeah.
I think I'm going to register to vote."
Wow.
I'm
We,
sorry,
we
what?
need more of those
I'm
instructors
sorry.
like that
You're
because
gonna.
they don't know. They
You
didn't
are a
vote.
grown.
They don't vote before.
You
Never
are a
registered.
grown man. You are in the nurse practitioner program, and you're telling me that you're not registered to
Wow.
vote in the state of Georgia. It just underscored to me how much work we have to do. People are not voting. And a lot of people, you will hear them say, but my one vote doesn't make a difference.
Mm,
Do
it
you know how
does.
many people have won elections here in certain
Yes.
counties by 20 votes, by 200
Yeah.
votes, a handful of votes? Your one vote matters.
If
Please,
we
you've
have
got to register to vote.
130,000, if we have 160,000 nurses, if each one of them say, my vote, that's
We
160,000
would
voices you
determine
lost.
who's the
The,
mayor.
yes.
We would determine who's the dog catcher.
Hmm.
We would determine anything. I'm telling you guys out there, this is my impassioned plea. If you don't get anything out of this, and I hope that you're getting a lot. If you are not registered to vote, you gotta register to vote. This is an
Yes.
election year. We are going to be electing a new governor, lieutenant governor,
Hmm.
secretary of state, attorney general. There's a litany
Yes.
of elections this year. Please register to vote.
Register to vote and share this to anybody or your family members, your friends, your neighbor, so we can encourage them to vote. And we're gonna push in this podcast. That's what we're gonna be doing. Try to have people engage. This is where our voice, the voices of nurses.
Absolutely. And then
Mhm.
after you register to vote, you got to educate yourself.
Yes.
Do not let, and hear me good, do not let your pastor, do not let your doctor, do not let your sister, your husband, or whatever say to you, "We're Democrats. We're going to vote up and down ballot Democrat." Or,
Hmm.
"I'm a Republican. I'm voting for all Republicans." Stop it.
Yeah.
Stop it. You need to educate yourself on who is for you.
Yes.
Nobody knows what my political leanings are.
Hmm.
You don't know if I'm Democrat. You don't know if I'm Republican, because none of that matters. I am the party of nursing. That's my
Yes.
party.
Healthcare. I'm the
And
party of healthcare.
I'm the party of healthcare,
Hmm.
and I am going to vote for someone who is going to get into that state house, and they're going to enact legislation that is going to move my profession forward. If you
Yes.
are a Republican, if you are a Democrat, if you are a dog or a cat, I need to know what your stance is
Hmm.
on healthcare. And so I need to educate myself on who it is I'm voting for. You
Yeah.
should not be going to a voting booth
And
and,
get to
and
know your
not
senators,
know
who this what
who
they
the people
support.
are. Right.
Yeah.
What is their platform? What is their platform? Then
Hmm.
you need to educate yourself and educate the people around you, because you want the people who are going to be most impacted. They may not be in nursing, they are your brother, your sister, the people at your church.
Hmm.
Let them know, these are the people that are for us, these are the people who are not. Then after you educate yourself, you gotta go vote.
Hmm. And then you know what? Even with the elected official, I
Yes.
think we as healthcare leaders, we need to educate them to empower them because some of the elected officials that don't know anything about healthcare, I'm wondering if they seek out to learn about healthcare. So we'd have to collaborate with them and then educate them about healthcare.
They do. They want to.
And I
They
would.
they want to. They want to know about healthcare, because I believe in my heart of hearts. I don't know what happens to people once they've been in power for too long. If the power dilutes their brain cells, I don't know.
Mhm.
But I really do believe that when people start out on this journey, we have a citizen-led legislature, right? These are
Yeah.
common folks. These are people with banking, farming, insurance, healthcare, transportation, infrastructure, you name it. There are people from all over our state.
Yes.
But someone in banking, infrastructure, or education, as a legislator, they may not understand your your
When
health
it,
care bill that you're
yeah,
putting forward.
mm-hmm,
And
yeah,
so they want to
to
know.
know.
They want to know. And so you need to engage with them. Here's another thing that you can do as an advocate. You
Mm-hmm.
may not be able to go down to the Capitol, but these people who are running for office or who are in office, particularly where you live,
Support them.
support them and reach out to them.
Yeah.
Call their office, your state rep, your state senator, and not just them, your city council, the
Mm-hmm.
community school board, all of them. You need to have a voice and you need to offer yourself
Mm-hmm.
as an expert.
Yes.
You can call me anytime. Call me anytime. I'll give you information about a bill that is focused on violence against nurses, or a bill that's focused on full practice authority for advanced practice nurses,
Yes.
or whatever it is. I'm an expert in that.
Mm-hmm.
So they need to be able to speak to people who are going to decipher what this whole bill
It's
means.
about.
Okay.
Mm-hmm.
So
Mm-hmm.
offer yourself as that expert who can work with them. Okay.
Right.
And once you work with them and you get them elected and you get them reelected, what's the next thing you need to do?
Keep
Hold
them
them accountable.
accountable.
Hold them accountable.
Yep, yep,
Because if
yep.
they're not meeting your needs, what should you do, Dr. Nozio?
So if you're not meeting them, you're not gonna be re-elected.
Vote them out.
Put them out.
Vote the bums out and put in, and you know what? Better yet,
Mm.
instead of putting in a new bum, how about you run?
That's right.
That's
Yes,
the next part of
definitely.
advocacy. You are a citizen just like them. You should run for office.
Office. That's right. Anybody can run as long you get the knowledge, you learn, you engage, you support. And then what was the slogan again? You
Show
show
up,
up
stand up, and
and
speak
speak
up.
up. Yes. Once you can do all those three, you can run.
Absolutely.
Well,
Because we need you.
yeah.
We need more nurses in the legislature, just a handful. And that's what makes it very difficult for us to get our legislation passed because the Medical Association in Georgia
Hmm.
is very strong. And I got to tell you something that physicians do very well that we
Hmm.
can take a page out of their book. They show up for their organization.
They do. Yeah,
Okay.
they do.
And there's a lot more nurses in the state than there are physicians, but they show up for their organization. They belong
Hmm.
and they give money. So
Yes.
their pack, the coffers of their pack are brimmed. They're brimming with resources and dollars for them to get their education, for them to get their legislation passed, and for legislators to hear them. Okay,
Yeah,
so
that's
we
smart.
need to be able to
That's the
take
one.
a page out of that book. You got to show up. You got to support, and you have to give your dollars.
So think that's what as nurses we are lack of the support where they will compare nurses and medical doctors invest on the legislators to help them bring whoever they wanted to bring and then they vote too. Nurses, we focus too much on staying back, lay back
I
or
know that
lay.
we're tired. You worked 312s back to back, and you picked up another PRN thing. The school fee is due. You need a new car. You
Car.
need this. Da, 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 da. But if we want to see change, we gotta dig a little deep. You know, I like to tell people that nurses are in the middle of their own civil rights movement. See, back in the 50s and the 60s,
Hmm.
when things were so hard, so tough, we stood together because we wanted to see change. If one person couldn't sit on the bus and they had to sit in the back of the bus, none of us are getting on the bus. We
Hmm.
will all walk until something changes. We are in the middle of that time now where it requires all of us to show up and to speak with one unified voice and demand change.
Change. Hmm. And I've seen that we're moving. But we're moving too slow. There are some changes from nursing to coming from we were to where we're at now, there are some change, but we can do better. We're not moving enough. We're not making the changes enough. And our voice, we are too silent, like you
We need a
mentioned earlier.
longer bench of individuals who are willing to go to the Capitol and fight on behalf of our profession. When I became the president of UAPRN,
Hmm.
we had not had a piece of legislation passed for advanced practice nurses in 15 years.
Wow. For as
I
much.
became the president and I said, heck to the no. These people are paying their dollars into the organization. I am responsible for giving them outcomes.
Hmm.
I'm not going to take your money and not give you what you have come to get. It's going to be giving, honey. If
Yeah,
I have
yeah.
anything to do with it, and so therefore, between me and my lobbyist and a small group of leaders,
Hmm.
I rallied them and said to them, look, it's not time for silence.
So we need
Go
to do
down there
something better. Yeah.
and be vocal. And if they want to push you down, push back. I've
Yeah,
gotten into
yeah.
so many fights in committee meetings, subcommittee meetings, and this. I'm from New York. This we eat fights for breakfast, lunch,
Well,
and
it's
dinner.
a
So they
good
had the
fight.
right one.
Like who would say it's a
Good
good fight?
trouble.
Good trouble. Yeah,
Good
good trouble.
trouble. Yes, Congressman
Oh
Lewis.
my goodness.
Yes,
Oh, what? Wait, listen, because I have so many questions for you. We'll have to
forget those
speak the whole
questions,
time.
honey. We
So
have a
how?
conversation.
Yeah. So I would say how can bedside nurse effectively engage lawmakers without prior policy experience
The
if they
same
don't
thing
have
that I've been saying, and I will say it again and again. If
show
I have to
up?
say it 1,000 different times, bedside nurse, school nurse, academic nurse, whatever kind of nurse.
Hmm.
Okay, I don't care what you are, and that's the one thing about teachers that makes them so effective when they go to the Capitol. They come as teachers. They don't come as who teaches third grade, who teaches physics, who teaches high
Yes.
school.
Hmm.
They are teachers, and that's it. And
Yes.
we need to get out of
Nurse practitioner.
I'm nurse
Nurse.
practitioner. I am critical care.
Mhm.
I am ER.
I'm oncology.
I am whatever. I am a Barbie doll. I don't
No,
care.
yeah, we're nurses.
I don't care. What would you want to impress me? What 11 organizations do you belong to? How much money did you give to the PAC?
Lot.
Are you showing up to the dinner meetings?
Yes.
They have dinner meetings every month. You're not going to get the steak dinner with the wine.
Mm-hmm.
When was the last time that your state rep and senator heard from you? Do they even know who you are? They know who I am.
Yes.
They
Yeah.
call me. If
You're
the
right.
governor
You're
needs to
right.
call me, if the secretary of state needs to go, they know who I am, and
Mm-hmm.
they know I get results. They know who to call, but I shouldn't be the only one.
Yes. Yes. I
They're
agree with you.
looking for people to call. This state needs to be blanketed advocates who, if anybody, I don't care if it's teachers, doctors, or whomever, no one is better than us. Nobody.
I would like to see at the Capitol we have at least 100,000 nurses showed up on the 11th of March.
Well, 100,000 on the 11th of
So
March,
we have
which
about
is GNA
160.
GNA Day at the Capitol. So shout out to GNA. I'll be there. But we
Mhm.
also have APRN Day coming up.
When is
February
APRN Day?
APRN Day is coming up February 24th at the
Okay,
Capitol,
I'll
same
be there.
location. So
Yeah.
if you want to get more information about that, you can go to www.uaprn.org.
Okay.
I'm going to be there the
I'm gonna be
whole
there.
day. If you want to meet me, come see who this big mouth is sitting here trying to get you riled up and inspired. Meet me at the Capitol
So I will be
Tuesday,
there.
February 24th
Hmm.
at 10 a.m.
You think
Oh
we should?
no, from 1 p.m. to 3 p.m. 1 p.m. to 3 p.m.
So we think you should. We should bring the podcast down there and then have everybody join online live or come in. Call them to come in.
Absolutely. I don't know that we'd be able to get a room because the rooms at the Capitol are tight. But
Oh yeah, because last year they were tight.
let's talk about what we can do, even if we just take a camera down there
Yeah,
and
yeah.
we just do some on-site interviews with people. We won't be able to do it with the microphones and all that, but most
Yeah.
certainly
Yeah,
take them to
but I
a
have like fancy microphone.
okay, then let's mic people up
Okay.
and let's get them fired up and
That's right.
let's get them, it just takes a spark. It takes a spark. Someone believed in me. Even
Hmm.
someone who worked for me said, Dr. Nelson, you don't see it, but we see your energy and that's what we need. And I was like, it's crazy.
Yeah, you do have the energy,
But
and
it
you.
just took someone to say to me, Michelle, you got it. You can do it. You have a voice, and we need some of that. Even if you didn't give us all, if you
Mhm.
just gave us a little bit of that energy,
Yeah.
it's more than what we have. Somebody did that for me, and I'm doing that for you. You guys out there, you have it. The fact that you are a nurse means that you have the expertise that we need. We want to hear those stories at the Capitol. That's what resonates with legislators the most.
Hmm.
Hearing your story, storytelling is one of the most powerful tools that we have. When
Yes.
you come to the Capitol and you tell about your patient who you saw that had a little sore on their toe, and
Okay.
because you couldn't write the orders for home care, the patient went into the hospital and they were released and there was a delay in
Hmm.
home care on top of that because of federal laws that are blocking our ability to write for
Yeah.
diabetic
I,
so this
yeah, you
poor
know,
diabetic patient that had the little sore on their
on the
toe
toes.
now
Hmm.
has a toe amputated, the foot, the the
Yeah,
the lower
gangrene
cat.
all the way up.
We they need to
Hear
hear
that.
that.
Hmm.
So if you can't be Dr. Nozil and you don't want to be Dr. Nelson, but you know how your patients suffer and that you are the only thing standing in between life and death for them, and you want to see better in wherever you're serving, we want to hear from you. We want to hear
Yeah.
from you. Contact her. She'll give you my contact information.
Yes.
I need you.
That's right. And Dr. Nelson, when you're talking about show up earlier, you show up today to be here today.
I show up everywhere. I
Ah,
show up. When
yeah.
I was the president of UAPRN,
Hmm.
we had chapters all over the state, right?
Right.
And chapters have monthly dinner meetings. I was so concerned with making sure that the members of the organization not just heard my voice, but that they saw me in the flesh,
Yes.
and that I would drive 5 hours,
Wow. Yeah.
5 hours to North Georgia. I would drive 5 hours nearly down to Valdosta to attend a dinner meeting
Wow.
so that people saw me and they
Hmm.
heard from me and they understood that they had a leader that valued them, that I was willing to drive in the dark. Sometimes I was driving in areas where I saw Confederate flags
That's
flying.
impressive.
And I was like, oh my God, am I going to make it back home? But I did not stop.
And your husband deserves a medal. Yeah, he does deserve a medal
I'm not going to
because
say that advocacy doesn't come with a cost.
yeah.
There's a cost for this. If you're running on fumes like me, sometimes, your health can take a toll, your career could take a
Yes.
toll, your
Hmm.
marriage could take a toll. But, one thing about my husband, he is probably the most perfect man that God crafted.
For you.
He is like the embodiment of what a true gentleman is and understood that he was my partner in being able to do this work. And so, therefore, he did not put any conditions on me. He did not, say, I need you home. Where is the cooked rice and peas and the oxtail and the da 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 da? He's not asking for that.
Yeah.
It's go, Michelle, go.
Oh, that
Go,
is so nice.
Michelle,
He would
go.
love to hear that, but probably heard many of those stories.
He hears it all the time.
Uh-huh.
And I do not, every time I go get an award, it's dedicated to my husband because
Yeah,
he created the space
for you.
for me to
That's
be
right.
able to do this work. So that's also very important too. that we have space created to do that. We need to do it with our partners and we need to do it for each other.
Yeah, yeah. Oh, Dr. Nelson, we
I think
can
we need a
go
part
on
two.
and go.
I
Oh
think
no,
we need a
we
part
need a
two.
part two.
This
We're
isn't
gonna have to do
enough.
a part two. We need to do.
I didn't even
We
answer the
don't,
question.
no, I have like 10
I
questions.
didn't even answer the
We
question.
know I have 10 questions.
Invite me back, Dr.
Yes,
Lucille.
I
I
will.
have
I
so much
will.
more to say.
Yes, I will invite you back. And then I'm very honored and I'm very impressed about your
Don't you
work
make me
and
cry
what
because
you do in the
I'm a
community.
crybaby. Don't
Oh,
you try
I
to make
am
me
too. I
cry.
am too.
Oh,
I am
shucks.
too.
Uh-oh.
Because very impressed with what you're doing for the community,
Yes.
what you're doing for the professions,
Yes.
and what you're doing. More impressed with what you're doing for the students. Oh, I don't want
You're
to.
gonna have to share this with me so I can share it with my babies at Clayton State. You know, these are grown
Yes,
folks.
yes.
Some of them are older than me, but they're all my babies
Hmm.
because you know I I'm my cup is so full.
Hmm.
It's so full and bubbling over that I'm still able to give to them from the overflow of the cup of what my creator has given me to be able
Yes,
to do
yes.
this work. And so, like I said to you, someone poured into me from their overflow. It is my job to pour
Give
into
back.
them and to make sure that there is succession planning
Hmm.
so that the work doesn't end with me. If you want to ensure your legacy, you have to train others and you
Hmm.
have to share with them.
Yeah.
Because my students, I tell them all the time, Michelle Nelson is great. There's no getting around that. I am great at what I do,
Hmm.
but I want them to be Michelle Nelson 2.0, 10.0, 20.0. Take what I've given you and expand that.
Yes, yes.
Okay.
And if I got what they're getting now, I would be far away from because I've learned about policy late in my nursing
I
career.
didn't
In
get
the
this
beginning,
when
I
I
didn't get it.
was, I, but maybe I wasn't listening because I was deep in the club.
But
Like I said, dancing my
but
buns off.
yeah, I was
But
also
but not
very.
at this
I
level.
was
I
a.
didn't get
I'm
this.
still a social butterfly. I am, and then
Okay.
I know I didn't get it in
Me too,
class.
but we're gonna keep it a secret. We're not
Yes.
gonna let them know.
And I'm a professional student.
Okay.
So I didn't the things that I'm getting for the past 3 4 years about policy, what I've seen is going on when it comes to healthcare, when the changes that happening on healthcare, it's just like blew me away.
Yeah.
And I wanted to learn more about it. That's why I've collaborated with an expert like you
Uh-huh.
to um to mold me, to help me grow with this path, so I can do better for my
Yes,
students also.
absolutely.
So I can start
Each
teaching
one
it.
teach one.
Teach one, yes. So I'm pleased and thank you for coming. And I would also invite you to come back so we can speak more and then have more member. The current president of UAPRN also would come in,
Oh,
and then
fantastic. Shout out to the most honorable Dr. Nancy Herlock. We
yes,
can't
she's
wait for her
coming.
to hear from you.
Dr. Herlock was
That's another
coming.
powerhouse right there.
Really, yeah.
Yes, 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 yes. So
Can't wait for her to come
no, no,
in.
no, no. And so, I just want to congratulate you.
Thank you.
And for, we had talked before, like, what made you do this? How did you get started? It doesn't matter. It's the fact that you wanted to, and you
Yes.
were going to find a way to get the equipment and start rounding up people and getting them here to speak with you.
Hmm.
And we'll find more people for you.
Yes,
We
yes,
most
we need
certainly
it.
will. We will shake the bushes for people to come in and be on your podcast because I'm grateful for the work that you're doing. This should be an example for everyone out there that you too can do advocacy in your own way.
Hmm.
It may not be a podcast. Maybe you're not the one having the podcast. Maybe you're me on the podcast. Maybe you're the person listening to the podcast and growing from this
Go.
and going and sharing it with your
Yes.
colleagues, with your students, with your peers, with your neighbors. Like, you guys got to get activated. Get activated. Get into it.
Yes, get into it.
Get into
Yes.
it.
And thank you. And if you're the one who's watching this, please share. And then if you write comments, let me know what you want to hear more. I want the APRN, nurse practitioner, PA, doctors, everybody, anybody who has anybody healthcare on healthcare, family member,
The
patients.
patience.
Yes,
Yes.
patients. I want to hear from you and let me know what topic you want to hear. What do you want us to talk about? Because nursing, healthcare, it's very vast. So I wanted to leave you with um, let's learn, let's lead, and let's shape healthcare together. And then the other uh,
Listen,
things.
y'all better do what I'm telling you now. Us is an F minus for everybody. I love to give out F if they don't do what I say.
Yes.
So everybody's going to get an A because they're going to show up, then they're going to stand up, then they're going to speak up.
Pick up.
A pluses all around.
All right. Thank you. Until next time.
Do you have a voice, a story, or expertise that healthcare needs to hear? Voices in Nursing with Dr. Nozil is a professional podcast elevating conversations at the intersection of care, leadership, and health policy. We're inviting chief nursing officers and nurse executives, bedside nurses, and advanced practice registered nurses, nurse educators, and academic leaders, hospital and healthcare system leaders, patients and patient advocates, family members and caregivers, policy leaders, elected officials, and community advocates. If you have expertise, lived experience, or insight that can educate and inspire, there is a seat for you at this table. To become a guest, email Dr. Nozil at ynozil@gahealthcaretraining.com. We look forward to amplifying your voice.